This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult a qualified healthcare professional before making any health or lifestyle changes. Welcome to the Happy Healthy Her podcast, your go-to space for real talk, inspiration, and laughter as we navigate life as a woman. Let's dive in.
Hello, welcome to the Happy Healthy Her podcast, the show where we empower women to live their best lives, mind, body, and spirit. Hello, I'm Lorraine Kime, an empowerment and mindset wellness coach, guiding women to live authentically through self-discovery and self-healing. I will be your host today, and I am here with my two amazing friends and co-host. Cynthia, would you like to introduce yourself?
Absolutely. Hi, I'm Cynthia Penner, a menopause coach and author of the Menopause Map book series, and I guide women through the wonderful, sometimes wild world of menopause. My focus is helping women navigate this season of life with confidence through knowledge of what the heck is going on in her body and hormones. Welcome.
Thank
Nice.
you. Tracey?
Hey, and I am Tracey Mail, a health empowerment coach. I help people heal naturally by focusing on what really matters: nourishing food, daily movement, a calm mind, and deep recovery. So together, they're all the keys to lasting health. Thanks.
Yay, thank you. So I am so excited today. We're going to have a conversation and be diving into a topic that affects so many people, but often doesn't get the attention it deserves: neuropathy. I must say our guest today has a truly powerful story, one that reveals how her career has evolved and what led her to focus on this work. Our guest today is Dr. Sara Griffin, a DC doctor of chiropractic and the owner of Active Care Chiropractic in Victorville, California. She is one of my own chiropractors on my healing path. And Dr. Sara, I would love for you to share a little bit more about who you are, what brought you into chiropractic care, and the passion behind what you do.
Great. Thank you so much. I'm happy to be here. So my story is much like many chiropractors. I was 18 years old. I had been in a car accident. I had a chronic neck injury for years that very few people could really help. I suffered for an entire year when I was 18 years old. And my mom finally forced me to go to a chiropractor. And that was the first time in a year I could turn my neck completely. So over the years, I'd been in multiple car accidents. And I'm a passenger in most of them. Very unlucky. Don't drive with me. There's the takeaway.
Clearly.
So, but I'd had a lot of spinal issues and nobody really could address them. I had one really great chiropractor, two great chiropractors, and the rest were kind of just meh. And so, like most of us, you get to a crossroad in your life. And I was working for an eye doctor. And so I was either going to go back to school and become an optometrist, or I had another car accident and my chiropractor just seemed a lot happier than the optometrist. So,
Oh my gosh.
well, we really perform miracles on a regular basis for our patients. So at any rate, I decided to go ahead and go the chiropractic route. So I have had my own practice for the last 17 years. And during the pandemic, everything changed. I was an acute care doctor and I loved being an acute care doctor, meaning that if you came in, your back hurt, we'd adjust you a few times, say, see us when you need us, right? So did that and was very, very happy until the pandemic, because at that point, I'd never really had a bunch of very complex cases that I couldn't just refer out. Now I can't refer out to anything. I can't get x-rays. I can't get MRIs. I can't get anything for my patients. And I'm stumped. I'm dumbfounded. I can't fix them. And I'm a fixer. So that's when I started looking to go back to school I was going to become an NP, a nurse practitioner, so that I would have these options for my patients. But that meant another $200,000 in loans. It meant another 5 years. It meant me as a doctor having to work under a doctor as a nurse before I could become an NP. And that really wasn't sitting well. So during this time, I fortunately came across a group of chiropractors that were doing what I wanted to be doing for my patients. So I jumped in full force, started training every 8 weeks. I continue to train. I just got back from a 3-day conference, going again in 2 weeks for some more training. I don't think you're ever done learning. And that's when we came across the neuropathy protocol. So that's how our practice has evolved, is we went from just see us when you need us to let's get to the root of the problem, because this goes so much deeper. And now we can help the most complex cases. So those miracles that I talked about before, they are far more significant than just watching somebody walk out without pain. We're giving people their lives back.
Wow.
Nice. That's very cool. Love that. One question I have is, how do you know? I'm thinking about my dad here, because he comes up in every episode. The poor man he's so healthy, but he seems to have a lot of problems. How do you know if it's just like neuropathy, or is it a pinched nerve? Because he goes to a chiropractor, right? He gets cracked. He's extremely active, and then he'll be doing something, playing a guitar, just sitting, whatever, and his hands go numb. They just go completely numb. And then it's like, okay, well, he keeps getting, nothing seems to be working. This has been going on for months. And I know that, again, it can stem from like a Hashimoto's or an autoimmune disease. And I just realized that I've had that probably my whole life. So, and it's genetic. So he could also be just undiagnosed. I just want your feedback, your thoughts on all of that.
No, that is something that is the first part that we do when we have a patient that comes in, is we want to get to the root. So
Right.
if somebody's having numbness and tinglies, like for instance, your father, his actually sounds like it's musculoskeletal coming from the spine, because most patients that have neuropathy, it is unrelenting. And
Okay.
it starts out very slow. It's very insidious. Starts out, my feet are tingly, okay? And it's bilateral. So it's both feet or both hands or both.
Yep.
And it usually starts in the toes, and it kind of works its way up. And then there's the burning. And so there's a lot of symptoms that really lead us towards a diagnosis. But we also do a very thorough exam. So getting the sensation checked, you get temperature checked, you get vibration checked, you get light touch. We do all these tests to determine whether it is musculoskeletal or if it is actual true neuropathy.
Okay, good to know. Cool, thank you.
Yes.
Thank you.
So, Dr. Sara, I think so many women listening can relate to not getting to the root of the problem. Like what you're talking about is they're not walking in like how you answered Tracey. It could tingling, but it's coming from both feet, both hands, and it's constant and it's slow and it's going to get worse. When it comes to pain, like as someone who works closely with women navigating menopause, I often hear them describe the numbness, the tingling, the burning. But again, they're not sure if it's hormones or something more. So when you're saying you're getting to the root of the problem, I'm guessing then, like when we had talked with Dr. Midori, it's the time that you're taking. You're, like you said, it's not just see you when you need us. Let's have a conversation. Let's lean in. So for a woman experiencing that, how can they recognize when they need to come see you, or if it's something they need to brush off or see someone else for? Like, what would be your advice for that?
That's an excellent question. So generally speaking, as women, we don't listen to our bodies. We put everybody ahead of ourselves. So anything that's going on that's persistent for more than a few weeks, actually, you really should come and get it checked out. When we're going through menopause, there's all these different factors hormonal, you're not sleeping well. But the big thing that I would recommend is document the symptoms. So you want to know when they started. Are they getting worse? When do you notice them? What does it feel like? So there's a lot of different questions that we're going to ask and then go back into our past. So for a lot of us, like me, I've had multiple car accidents. So if I had neuropathy in my hands, I'd be looking at my neck for sure, right? Because I would be thinking it was my neck. But that's where when we go in, we want to get that entire history of your past. So I recommend to my patients that, you write down everything that you're experiencing, because your doctors are only going to have a limited amount of time with you. So if you have the who, what, when, where, why, and how basically mapped out, and you go in, you say, okay, so I've been having bilateral foot numbness and tinglies for the last 2 months. It doesn't go away. It's worse with increased activity. It feels like pins and needles. Sometimes it feels like I'm walking on marbles. These are all true symptoms. And then what have you done, right? Like, what have you done to treat it at home, or have you done anything else? So those things would be like, well, I tried to ice it and that didn't help. I tried heat, that didn't help. We need to know what's working and what's not working as well. So those are good things to document. And then being realistic about your underlying conditions, like we were talking about, like she was talking about Hashimoto's, diabetes, clearly, toxins that you're exposed to. Some of us work in industries where we don't realize we're being exposed to a lot of heavy metals and toxins that can cause this. Clearly, if you've had cancer and you've been exposed to chemo, even though it may have been, 5 years ago, we still need to kind of look at all those things. So really getting it down to the nitty gritty on what your symptoms are and documenting those properly.
Wow. Thank you for that. Thank you for that reminder. I think of a story. I have a friend who is a really close friend, and I actually created a course on hormonal balancing. It's on my website. And one of those is a symptom tracker. And I sent her my course for her to proofread it and just kind of give me her opinion. She printed that out and she did it for a whole month and then took it to her doctor and said, and the same thing, like, you're absolutely right. Like, document the who, what, when, where, and the things that you did, because then you can pinpoint it, right?
Yeah.
But I'm
exactly.
also guessing her coming to you with that sheet is a lot different conversation than going to a medical doctor who's going to say, well, it's just age, or just whatever, women, or you're whiny or whatever. So, yeah.
Drink some wine. Yeah.
Well, I mean, I'd like to think that
Did
this.
you say drink some wine?
Yeah.
Exactly. I like to think that, I mean, I am an optimist, but I'd like to think that if it is concise enough and it is for just one condition, your MDs can only handle one thing at a time. Don't give them more than one thing. But if it's just for one symptom, I mean, for one area, and do that in multiple visits for them, I think they would be grateful for it, or at least have it in your mind so you can just tell it to the nurse so that the nurse can document it properly. And I do feel like our doctors that are coming out, this whole generation, several behind us, I feel like they have more empathy towards people. So hopefully that'll change for women, especially since we are the majority. So
Right. For people who don't know the difference between, or even how you categorize neuropathy versus the nervous system, I remember Dr. Mordori saying something about the adjustments and everything also work and are in line with the nervous system. And I had never really thought about it in those terms. And so if you could tell us more about the nervous system and chiropractic care and neuropathy, and are they the same? Are they different? How is that?
Gotcha. Okay. So with general chiropractic, we are relieving pressure on the nerves. That is us in a nutshell. But there's different types of nerves. So these are the spinal nerves. When we adjust you, we take pressure off that nerve. That in turn reduces symptoms. So if you have a pinched nerve in your neck and you've got hand pain and we adjust you and that hand pain goes away, we know it's coming from the neck. So as far as the difference with your peripheral neuropathy, that the peripheral means the peripheral nerves. So those are the ones that come off. They're generally associated with sensation, the heat sensation. That's how we know when something's hot. Pressure, light touch. So there are different nerve fiber, and they're very delicate. So when we have a condition like Hashimoto's or an autoimmune disorder or diabetes, our body is highly inflamed and we don't regulate our blood sugar very well. I have a theory. It's clearly just a theory because I've never researched it, but I believe that inflammation in the body more than the blood sugar in our body is what is causing the neuropathy. That's why we have so many idiopathic neuropathies that nobody can say, well, this is the reason. So people with high blood pressure are at risk. I mean, just anybody who's got a lot of inflammation in their body, those nerves are so sensitive and they're farthest from our nervous system, right? They're farthest from our spine. So they're the most vulnerable. So was that accurate?
Yep.
Yeah, so thank you for that, because I
Agree
just
completely.
didn't know, and I'm sure there are a lot of people who just aren't really sure what we're talking about to the difference. So I appreciate that. Thank you. So we want to talk about why it works, and we want to talk about your own methodology, why it's unique, why it works so well for your patients, and that whole person approach that Dr. Midori touched on when she was here before. I'd like to get your perspective about that as well.
Gotcha. Okay, so I'm just going to go ahead and check over my notes really quickly, make sure that I've got all the stuff. Okay, so with neuropathy being such a complex condition, we start with the process. What is the process? Is the process because of an autoimmune disorder? Well, then we got to put out the fires. We've got, if it's from diabetes, if it's from Hashimoto's, if it's from arthritides like psoriatic or those types of things. Then we have to put out the fire so that all of the other stuff that we do is going to be more effective. So especially with diabetes, we first want to get them on a lower blood sugar diet. We want to supplement with the B vitamins and the R-alpha lipoic acid. And so we want to start healing from the inside, right? Because we can do all we want on the outside, but if the inflammation is and the blood sugar is just out of control, we're fighting an uphill battle. So now we have lots of patients who don't follow all of our recommendations and still get results. And that is because of what we do for the nerves themselves. So with peripheral neuropathy, we're talking about those little nerves on the end there. We use a combination of therapies to promote the healing of those nerves. So the big thing that we start with is there a spinal component? Because the big nerves go to the feet, go to the hands. If those are being damaged, if they are having pressure put on them, again, uphill battle if we don't take care of the entire complex of the nervous system. So we generally will start with the spine, making sure that their spine is healthy or being helped while we're doing this. Now, the next thing that we want to focus on is we want to focus on making sure that those nerves communicate properly. So think of a nerve fiber like a wire in our house, okay? Now, if somebody strips off the little rubber insulation over that and it gets kind of damaged, we're going to be glitchy, right? We're going to turn on a light. It's going to work. It's not going to work. So think of the nerve like that wire that has multiple pieces of that plastic, that outer lining pulled off, and then the wires are being exposed. So it's not getting the right signals. So what we do is we use a nerve stem, and what it does is it starts at your foot. It goes up to your lumbar plexus in your low back, goes back down, and these currents actually tell that wire, tell that nerve, you've got a problem here. Let's send some frequencies here so that we can retrain this area how to communicate. And then it just keeps doing that, keeps doing that. We keep doing that until there is much better communication between those nerves. So there's part of the nerves that they need to be able to communicate to each other, right? So to the spine. So we help with that. And that is a technology that is used with the Cancer Centers of America because they're having such good results with the chemotherapy neuropathy with this technology, so that the patient's body can start communicating with the spine again. Spine to the brain to down, blah, it makes a whole loop. So
Cool.
that is imperative that the nerves are communicating properly. Next, biggest treatment that we do is for angiogenesis. Angiogenesis is a very fancy word to create new blood vessels. Okay. Now, remember that wire that doesn't have the rubber around it, the lining around it? Well, in nerves, that's exactly how it looks. You've got like little patches of our nerve that the myelin sheath has come off. So we need to feed those broken areas, and how we feed that is through blood vessels. So angiogenesis, creating new blood vessels to the area, that's going to feed and nourish those nerves so that they can heal properly. So there's a whole we want you in the rehab room so that you can, again, with the balance and recommunication. The other technology that we use is to get rid of the inflammation in the area, because most of us, when we are having an issue like this, our feet are swollen, our hands are swollen because they're not getting the right signals. So we need to make sure that that inflammation is out of there. So we take a very multifaceted approach to make sure that all aspects are coming together to heal this nerve, because they don't want to die. And everybody thinks that once you get neuropathy, your nerves are dead. This is absolutely the farthest thing from the truth. And it's very exciting to know that we can start from the inside, lower that blood sugar, lower that inflammation by a healthy eating regimen, and by getting the right B vitamins and the right supplementation. And then we can make sure that the spine is healthy and those nerves go into our extremities are getting the right signals. Then we're going to bring back in, we're going to get rid of all that inflammation. We're going to bring in all that new blood flow. And that is how we are different and getting the results we're getting.
Wow.
Nice.
Oh, that's amazing.
That is amazing. I really appreciate you're talking about treating the whole body and not just masking the symptoms, because something I see in midlife women is that we try to push through the pain instead of asking what your body's trying to say. So in your work, do you find that once patients start to support their nervous system and circulation, they also notice benefits beyond just their neuropathy symptoms?
Well, absolutely. I mean, one of the big things that we notice for women or patients in general is they start to regain balance. But if you're not hurting, they increase their mobility. They get moving more. If you're eating right, your mental health is going to be better. That's just the bottom line.
Yeah.
Your sleep is going to be better. Your poops are going to be better.
Yes.
You heard it here first, ladies. Your poops are going to be better.
Right.
They won't
Well,
smell.
most patients don't understand, right? They don't.
Yep.
No.
Most patients don't understand that the nerves that innervate your bowels come from your low back. So if you're a woman who sits at a desk all day and you've got terrible constipation or irritable bowel syndrome, a lot of times a good old fashioned chiropractic adjustment can take care of those symptoms because it's all connected.
Right.
Even like scoliosis, like if you have a curvature of the spine, because I've talked about this before, like I struggled with pooping from childhood, and I have scoliosis, and so I almost ended up with surgery over it. And so what you just said, like, is this a link?
It's linked. It is absolutely a link. So the
Ah,
way that it's twisting, it is probably putting extra pressure on those spinal nerves that innervate your bowels. So, right.
yeah.
So yeah.
Hmm.
I mean, unfortunately, there's not a ton that you can do for that. There's a company right now that's trying to research, like working specifically with scoliotic patients with like a body suit kind of a thing to kind of like pull muscles that are weak. Nope. Pull muscles that are too tight, allowing the weak ones to strengthen up. So it's pretty new. It's pretty cutting edge kind of stuff right now. But it's becoming so prevalent that these companies are having to find ways to help these patients. So
So
if you're
it's better than
interested,
the old-fashioned Milwaukee brace. They had
oh,
asked me if have you heard of that?
of course, of course.
Yeah, they introduced that to me as a teenager, and it was a hard pass for me. No, thank you.
And-
Because I'm not wearing that to school. School
Right.
is hard enough without walking into class with that.
Right.
Wow.
Well, this is more based on kind of like, are you guys familiar with kinesio tape? It's the stuff that all the athletes wear.
Yeah.
Yep. Yeah.
Yeah. So it's kind of based on that, where they are they're assisting the muscles, but they're still allowing there to be proprioceptive response between the body, so there is not weakening in the muscles. So it's it's definitely something that is unique. I don't have as much information on it as I would like, but it is something that if you're interested after the show, I can give you a little bit of information. I would encourage you to do your own research on it because I don't have that much information.
Yeah.
But I know that's where the industry is going, right? Because
Wow.
I did 3 sports physicals the other day, and I did 4. 3 of them had scoliosis.
Wow.
Right?
Wow. That's
What the
something.
Right.
heck?
Yeah.
Yeah. So
That's
it's
insane.
it's I don't know where it's coming from. It's probably our diet because
Yeah.
it's
Everything's getting weak.
yeah.
I did hear
it's,
there was a link with if you had braces as a child. There was a soft study that did that. They were saying if you had braces, then it developed scoliosis later in life.
What type of
From
brace?
being the metal in your mouth. What would
Yep,
what?
like I mean, I'm 55, so we're talking when I was a teenager, right?
uh-huh.
Yeah, so I did have braces. Didn't wear my retainer, but I had braces, and then I ended up with scoliosis. So the link was
Okay.
interesting to me. It was just something that always kind of stayed in my brain.
Well, there is something that makes sense. There's a whole field of dentistry right now that's trying to get away from those braces because there's a lot more problems with it. It's not so much the metal as it is that it is not allowing our sutures in our spine, I mean in our skull, to move properly. And it's overall there's this new theory that wants to spread palates instead of moving teeth around to make things like this. There's a lot of problems with actually the when the dural matter in the brain in the skull gets torsioned, that can cause a scoliosis in infants. So with you talking these braces, we're not allowing our skull to move properly. We can get those torsions, and I can see how that would go all the way down the spine. Does that make sense?
It
Yeah.
does. And
Yeah.
sorry for the rabbit hole, ladies. That's
Yeah,
just
for
my
sure.
No, it's
menopause
interesting,
brain.
right? Yeah.
Yeah.
Well, interesting. Um, I have a question, but when you talked about laser therapy and the angiogenesis, is is that red light therapy or what? Because that was kind of my understanding when I was reading the notes. Is that completely off, or what do you think of
Um,
red light therapy?
I think red light therapy has its place. This is actually low laser light therapy, so it goes penetrates deeper than red light. Red light's great. If
Okay.
you can get red light at home, great, do it. You're probably not going to get your hands on a low light laser, real low light laser therapy, because it's something that you need to be trained on.
Oh,
Um,
okay.
but red light therapy, sure, great. I just got myself an at home laser couple of weeks ago. So
Did you? Is
yeah,
there
I mean,
one
I
you
have
could
one.
recommend? Because I've been looking into those too, and I'm just not sure which one.
Uh,
Thanks.
Again, I purchased it, but I literally used it for the first time today.
Okay.
And I'm not ready to like
Recommend it.
fully.
It's totally cool. Yeah.
You want to contact me afterwards? We can talk. I can tell you. I just don't want to go out there just
Nope.
yet on that, right? I don't have enough research. I haven't done enough
Nope.
research.
Nope. Beautiful.
You know what I
That's
mean?
good.
It's my name is on that. So
Yeah. Oh, absolutely. Yeah. That's no, I appreciate that. Okay. No, because I was wondering if if you thought red light would help with fibromyalgia and Hashimoto's. If,
a hundred
you know,
percent,
yes,
hundred
okay. Because you
percent.
clean up your diet, you do everything else, that might just be the cream of the crop, right?
Right,
Okay.
right. When you're doing red light therapies, you want to make sure that there's a broad spectrum of colors. So we
Okay.
have the violet, we have the green, we have the orange, we have the red, and blue.
Okay.
So you want a multispectral one.
Okay.
So
Okay. That's cool. Thank you. Thank you. I'm just
yeah.
taking a note there. Okay. Good. Thanks.
And I
Mhm.
wanted to mention about the nerve regeneration and the blood vessels regenerate. I mean, I don't think enough people understands so much can be done. We think it's just boom, the nerves are dead, they're dead, that's the end of them, we can't bother with it. And then like what you were just saying about the myelin sheath and the fact that you can regrow new blood vessels and stuff. I mean, that's just amazing. Could you kind of expand on that a little bit for our audience?
Right. Okay. So this is something that most people will understand. Everybody's heard of a nerve block or where they kill the nerve. If the nerves truly died that quickly, then we would never need another nerve block again. So our nerves want to regenerate. So, and how they do that is being in the right environment. Just like any other healing, right? Like if we have a shoulder injury, if we get it adjusted, we get the inflammation out of there, we do the rehab, we do the stretching and the strengthening. What do we get? We get a good shoulder. Same thing with our nerves. If it is given the right environment, they want to survive. They want to go ahead and grow. Now with angiogenesis specifically, we do a few things for that. We do an actual manual manipulation of the tissues in the feet and in the ankles and in the calves, anywhere along where the nerves traverse. We will stimulate those. Additionally, we do use sound waves, not ultrasound, but actual deep sound waves, like it's extracorporeal shockwave. So extracorporeal, that is right there in the word, the corpuscles, the blood vessels. It's extra. We bring them in. That's what we do. And then the stem cells that our body naturally produces helps to heal and repair the tissues. So
Would that be
So
the
cool.
shock wave when you're talking about the
mm-hmm.
sound? Yeah.
Mm-hmm. Yeah.
Yeah. So I personally have had these treatments done on me, the shockwave and the laser, and I thoroughly enjoy them. So it's a great new technology that I did not know existed, especially in the chiropractic office. So I'm very grateful for it. So thank you for that.
Yours is a
So-
different protocol than what we would use
Oh,
for
yes.
neuropathy, but yeah. Mhm.
Absolutely. I am not
Mhm.
in treatment for neuropathy. That's why I really don't know that much about it. But my husband does have type 2 diabetes, and I know that he is dealing with it. I don't even understand, all that he goes through and everything. So I am very glad that there are these therapies around that can help him with that as well. So, did we get all of our questions in, ladies, before I move on?
Yeah, I think so.
Okay, good. So we want to let the listeners know how they can use these certain things. So as their symptoms, I mean, most of us, especially women, you've talked about it, we've talked about it. We feel stuck or we suffer through things. We put ourselves in the back burner. We just tell ourselves we have to learn to live with these limitations, these discomforts, and we don't want to do that. So I know that your approach gives people a lot of hope. And so I was hoping that you could walk us through those first steps and recommend, what you what you think women should do first, what kinds of small steps they can take, and clarify any misconception that they might have about your chiropractic methodology or especially neuropathy.
Right. So the one thing that I'm gonna just have to go back to is get that history, right? We already talked about that. So you want to get that history, and you want to make sure that you are probably getting a recommendation for somebody, so that you're going to somebody that is being recommended to you. Unfortunately, our insurance companies tie our hands, and that's a whole nother podcast. You want me on that? I'm not. I'm just kidding. So, so that's the first thing I would do to get started is to make sure that you know what's going on. But some other misconceptions about chiropractic is that I mean, not misconceptions, because sometimes there's warranted that not every chiropractor is going to be the same, not every doctor is going to be the same. So do your research, do your due diligence, make sure that you're getting good recommendations. And if you're looking for a specific problem, call your local chiropractic association and say, hey, I'm looking for this. I have this problem. Who do you have in the area that you would recommend? That's a good resource if you don't know anybody, because most chiros that are putting their money where their mouth is, they're in it for the right reasons. And so you want to find somebody who's local, supporting their local area. The one thing I can say is that with neuropathy, you can go to your doctor all day long and you are going to get nothing. You are going to get a prescription. The most popular brand of treatment is gabapentin or Neurontin. Gabapentin is the original name and Neurontin is the brand name. These are anti-seizure medications. Yeah. So,
Wow.
yeah. How is it healing my nerve? How? Well, that's the misconception, right? It is not healing your nerves. You know what it does? It slows your brain down so much that you can't notice the symptoms. Right. Is that not disgusting?
We
That's
try not to
insane.
bash doctors on this podcast, but when we hear stuff like that, you just
Wow.
Bash away.
I know,
Well,
right?
but-
It's like,
but
come on,
in-
you guys.
In their defense, what else do they have?
That's all they're
What
taught.
do they have?
I
They don't have
know.
anything else.
Yep. They
And
can't say change your
truly,
diet. They can't say try this.
do you
But they-
know that up until this year, they only took one semester of nutrition and one semester of musculoskeletal conditions?
Yep.
One.
Yep.
But
That's
I don't
okay.
think that it's all the doctor's fault.
No, absolutely not. You can only work with what you're given,
Yep.
right? And unfortunately, that's all that.
But she wasn't wrong. They get one semester.
They
But
do.
say
Yeah, it's like less than
menopause,
40 minutes or 40
menopause
hours.
is one unit in the
Yeah.
whole women's
Yeah.
health. So
Yeah.
Yeah.
Yep. And all the nutrition, she'll have to come back. All the nutrition that they are taught is wrong because it's
Right,
based on,
right.
On
you
the
know,
pyramids.
yeah,
Yeah.
all the upside down pyramid and all this stuff.
But if
Ugh.
you go in with nerve pain and they're giving you anti-seizure medication, I mean,
Yeah, right? Like, come on.
oh,
Wow.
yeah.
Yeah.
So this is what they did before that. They gave them opioids that they got addicted to.
Oh, God.
So because they had to treat the symptom, they never could, because they were convinced that once a nerve died, it was dead forever. So again, like I said, we don't bash the doctors because they don't know any better. We
Mhm.
should bash the establishment that is putting out the doctors.
1,000%.
Absolutely.
So that's, you know what I'm saying?
Yes.
Yeah. Yeah.
Right. So I really forgot where. So we have an issue in our house. If you turn on the microwave, our internet goes out. So
Someone
that's
got
where I've
hungry
been.
for a snack.
I'm sorry. I'm like,
That's
I don't know
funny.
why. Yeah. So let's see here. What was that other myth that I had? I
Functional
think that was.
program. What?
Pardon me.
What? We
Well,
had
those were just some notes that I took based on her
root
notes. So
causes. Oh, I
this might be
see.
a
I
good
see.
time for me to have you bring that in. After talking to Dr. Midori, she explained to us about the functional medicine, and she was really enlightening us on that. So I wanted to ask you how you found functional medicine and how you are going to interweave it or add it to your whole body approach of care.
Well, so funny thing, functional medicine, Midori was kind of the one who had introduced it to me because she had so many. Uh, we were pretty concerned. She had PCOS. There were a lot of things that we were concerned about. She went on the journey first. She then, this was before she was even in the program. No, I think she was already in the program, or was right before she started. She was already living down the hill, so she had to been in the program. But I had heard of it throughout the years, right? But we've always kind of been on that spectrum of feed your body. What is it? Pay your farmer before you pay your pharmacist.
Yes.
Beautiful.
Yes.
Right? So, I mean, they've been calling me a witch doctor since I graduated chiropractic college. So, but that's because we know, we're given so much information about the things, how our body responds to food. So, and the same thing that we were talking about throughout this whole thing, inflammation. People think that, why do I have inflammation? Well, let's look at the why. What are you putting into your body?
Yeah.
Your body isn't going to just become inflamed unless you have an actual injury. That's what the inflammation is there for, is to try and heal. But once we get to that place where our body is just hyperinflamed, and everybody is on, now we're on medications that are masking symptoms, which are causing more problems. We have to stop. So functional medicine being that absolute jump off starting point for any condition, because I can work all day, but if you are eating like a 4-year-old and you are constantly re-inflaming these areas, I am only going to be able to do so much. And most people don't know this, but inflammation is the cause of our arthritis.
Everything.
It's the cause.
Everything.
It is
Yes.
heart disease.
Yep.
I actually used to do a seminar on inflammation is the root of all disease.
Yep.
So,
Yeah.
and it is. So it
Mhm.
always has been. So what I love about functional medicine that is different than just a food base, because I've always been just food based. I hate supplements. I'm the first one to say it. My daughter's got me on like 9 right now. I'm like, actually, it's only 4. I'm sorry, Midori. Dr. Midori. My doctor has me on a few supplements right now. But what I do love about it is you see where you are lacking.
Yep.
And my food's clearly not getting me there. Why am I still not thriving in these areas?
Yeah.
Well, because our nutrients in our food, we can't help it. We cannot help. We can't go to the store and get better nutrient food. We can go to the farm and get it from them, but then, it limits us, right? And I don't have any farms around me. I have a farmer's market, and that's as close as I get. And I try to go there, but I can't get the nutrients. So my functional medicine doctor, Dr. Midori, is making sure that I'm getting all the nutrients I need that my food is lacking. So there's a difference. And with functional medicine, we're taking ourselves to optimal level, not doctor level. Sorry. But there,
Watch your internet.
there's American medicine states that there is a guideline. If you fall within these guidelines, then you are normal. I don't want to be normal. I want to be optimal. And what you call normal may be bad for me.
Yes.
So
as soon as you get out of normal, you got a full-on disease. Like there's no, right? It's like, oh, you don't have cancer yet, but one more notch and you do.
Right.
Drives me crazy.
So, but that is the foundation of healing and wellness, is to start here in the body. And like I said, the best way to put it is put out that fire. Put out that fire, that inflammation that is literally causing all these disease processes. And if everybody did this, my practice would go down significantly.
So nobody eat that way.
So don't eat well.
Keep getting in car.
You are what you eat, right? You are what you eat.
You are what you eat.
You are.
Yep. That's crazy. I'll ask a quick question, sort of a question, more of a comment, I think. You're talking about the regenerative, how nerves can come back. And I was thinking, my husband, when he had his heart attack, he had a massive heart attack in 2018. And most of his heart is like the bottom 4 or 2 quadrants, whatever, they're dead. Like he's in a state of heart failure all the time now. But you never know what to look at. He's functioning. He's fine that way. But when they did the second angiogram a few months later, a vessel was growing to move around the damaged part. Like his heart was actually growing a new blood vessel. Right?
Angiogenesis.
Yeah, it's the coolest thing. Oh my God. Yeah, we have a picture of it from the angiogram. It's like, look at that. And it just makes you think the body is absolutely amazing. You give it what it needs, it's going to do its best to heal as whatever is possible. Right?
100%. Yes.
Beautiful. I think we kind of went over this, but I'll ask it again because people can't hear it enough. It's like, if a woman is feeling stuck with fibromyalgia or Hashimoto's, right, and they just feel like there's nothing, they give up, they're stuck, nothing's going to work for them, what would you tell them?
I would tell them to find a practitioner that uses Dr. Commoner's solution. It is an all-natural supplement that is designed to shut down or calm down our nervous system. We treat it in our office. We can do it virtually. So if somebody is like, we like to do a test in person if possible, because we want to make sure we're not just treating somebody that we haven't accurately diagnosed.
Right. Yeah.
Because even if your doctor diagnosed you, I still
Oh no, Jesus. Would not do that. Here, I don't know about there. We do a Dutch test, right? You can do the Dutch test.
Yeah.
And I'll have to look into that. We use it. I hands-on, but that would be a great way to, and then that way we can treat people appropriately, and we monitor it. It's a 12-week program. Within 12 weeks, most symptoms are in remission.
Right. Absolutely. It is reversible, people.
It is. It is.
Yeah.
Yay.
So good. Thank you.
I mean, obviously, functional medicine is another one that we have to, it goes hand in hand. I mean, we know what can help and heal those conditions. It's getting us to do the things that we need to do. You know what I'm saying?
Yeah, getting people to understand that the food that goes in their mouth is
Yep.
causing 98% of their problems.
Like
Yeah,
what we talked
anyway,
about on a
yeah,
different podcast, right? Like kiss me slowly, like keep it simple, right?
yeah.
It's
Yeah.
what you're putting in. So I did go see a functional medicine practitioner here in Alberta before I headed down to Mexico, and they did a scan, and I don't know what the name of the scan was, but it showed everything inside my body, like everything that was missing, everything that was on high alert, everything that needed to be addressed. And so she was able to target the high alert areas and calm them down. And then we went after, so I knew exactly what supplements to take, exactly what detox to do. And so, but in the end, after you do all that, we addressed my food. Like half of the appointment was, okay, here's the supplements, here what we need to calm down. Now you're going to keep it simple. You're going to only, have these things.
Mhm.
And so I'm a big protein eater. Like I'm pretty dang close to carnivore, but she taught me that you have to balance your omegas because it's not
Yeah.
like I'm eating eggs, but I was having no yogurt or flaxseed with it. So like there's a balance, but keep
Yeah.
it simple. What you are, what you eat.
Right.
Yeah.
Exactly.
Yeah.
Yeah. I'm very sensitive to that. What you're saying, where your omegas are out of balance, and my electrolytes will get crazy out of balance if I don't have the good, if I don't have enough of the fats with all that protein.
You
I have to have,
fat.
yeah.
Yeah.
So,
Oh, especially
and
being a woman, right? We have
yeah,
to have
right.
the high fat, healthy fat. Yeah.
Healthy
Absolutely.
fats. Yeah, exactly.
Yeah.
Exactly. So, but yeah.
Good,
Wow.
good,
This is wonderful. We've covered
good.
so much and we really thank you. So we
Yes.
have a lot to think about and a lot to talk about. And we have talked about some of the strategies, but I was wondering if you had like a fundamental empowering thought or practical tool that could get our listeners started, especially our women listeners. Could you share something like that?
Absolutely. First thing you want to do, listen to your body. She whispers before she screams. If she's whispering, listen to her. Advocate for yourself. We do not advocate for ourselves. We put everybody in front of ourselves. And I mean, this is just, common sense, but it's not common. If we aren't good to us, how are we good to anybody else? I mean, every relationship advice says love yourself first. You can't take care of anybody else if you are not taking care of yourself. And if you are leaving yourself to the 20%, the 80-20 rule is 80% of the people 20% of the people do 80% of the work. Same thing in everything in our lives. I mean, if you are putting yourself in that 20 percentile and you're giving 80% to everybody else, switch to that. You need to flip that switch because you're worth it. Going back to, right? Going back to
Absolutely.
documenting our symptoms, and try not to fix everything at once. Like keep it simple, slowly, right? Just keep it simple. And then if you feel like you've been going to the doctors and you aren't getting the answers and inherently something's not right, again, continue to advocate, but listen to yourself, listen to your intuition and fight. Because even if you have to go through 3 doctors, and if I'm going to be perfectly honest with you, stop paying for your insurance and start paying cash. You're going to get far better results. Just
Wow. Yeah.
If you're spending $800 a month for your insurance and you can't get into your doctor for 6 months, and when you do go, he tells you you're just in menopause, do better. Do better. Sorry. Now I'm not saying go without like major medical, because if something catastrophic happens, you need to have that, but put that money into your own bank account and use it for when you really need it. And that's the other podcast, but I don't have enough information on that either. I just have theories. I just have conspiracy theories, but
Hilarious.
We did a whole podcast. I hosted a podcast about intuition, and not listening to ourselves and things like that. So we definitely need to do more of that, listening to ourselves and putting ourselves first and all of our self-care. So I totally agree with that. Cynthia, did you have some closing comments?
So, Dr. Sara, I just want to thank you for giving our listeners such a hopeful message. So, what stood out most for me today was that healing doesn't always mean doing everything at once. It's about tuning into your body, documenting what's happening, and taking it step by step. For women in midlife, that reminder is so powerful because so often we feel like we're too far gone or it's too late to change. But you've shown us today that it's never too late for the body to heal when we give it what it needs. Yep.
Yay.
Yay, right? Absolutely. And I'd like to say every episode we come back the same message,
Yep.
right? Trust your body. Take the next step forward, and you don't have to settle or stay stuck. Goodness. Hopefully.
Because that
Wow.
sucks. 'Cause
Yeah,
sucks.
that does suck. See, the suck was in there somewhere. So hopefully our listeners are really starting to believe this and are already taking steps to improve their health. So thank you so much, Dr. Sara. This was great for helping us share this message and for giving everyone even more wonderful ideas and options today with this conversation. So thanks. This was great.
No problem.
Yes. Yeah, it always comes back to listening to our body and trusting
It
what
does.
we notice, you know.
Yeah.
So it has been so inspiring to see such complementary approaches to healing within your practice. You know, you really cover your bases and everything, and I just love that. So that's wonderful. So where can our listeners learn more about you and your practice?
Great. They can find us on our website at www.activecarechiro.net. We are on Instagram, Facebook, and TikTok, but we're not active on TikTok. So I would say Facebook and Instagram. And you can find our Facebook page through myself, Dr. Sara Griffin, on Facebook, and then the Instagram is ACC something. I'm sorry, Midori knows that one.
That's okay. We'll have
Okay.
it all in our show notes. We'll have links and
Okay.
everything. So we'll make sure that everyone can find you. No problem. So thank you so much again, Dr. Sara, for joining us and sharing so many wonderful and amazing insights. And to my co-host, it's always so fun having this conversation. And so I appreciate you all. And we invite our listeners to start a symptom and lifestyle journal for 1 week. We're challenging you for that. Write down your reoccurring pain, sensations, habits that may be affecting your health. Reflect at the end of the week and let us know what patterns you notice. So, thank you to all of our listeners. And don't forget to subscribe and share this episode with a friend who might need it. We are so grateful to having you listening today, and we hope you are leaving this episode feeling inspired and empowered. So remember, until next time, it's never too late to be the you are meant to be. Bye for now.
Thanks for tuning in to the Happy Healthy Her podcast. If you enjoyed this episode, be sure to share it with anyone you think would benefit from the topics we're discussing. We'd love to hear from you. DM us with your thoughts, comments, or ideas for future episodes. And don't forget to check out the links in our bio if you'd like to connect with any of us or learn more about what we do. Until next time, remember, in a world where you can be anything, be kind, be happy, and be healthy.